Afternoon, Eddie. Good afternoon. Thank you for joining me for today's weekly COVID-19 update. I'm pleased to be joined by Secretary Jose Romero of the Department of Health, as well as Secretary Johnny Key of the Department of Education. And of course, we have Colonel Rob Ader, who is our program coordinator for vaccine distribution. We have a couple of announcements today which have been anticipated, but this is an important day to start a new part of our journey through this pandemic. I first want to report that I had a call with the White House Coronavirus Task Force today, and I was advised that nationwide the states and territories would be receiving an additional 5.4 million doses of vaccine, and so the manufacturing, the supply chain continues to increase. For Arkansas, that means that we will receive around 25,000 additional doses of the vaccine this week, and that will be an increased level for the next 3 weeks as well. Let me first cover the case report for today, which should be our first graph. And our case report continues to look good. If you look at the very middle here, you can see that we had an increase of 178 cases over the last 24 hours. That is down from 1 week ago. Active cases are down. The deaths are 15. And I suspect, although I don't have that confirmed, that some of those would be late reporting. That seems like a large number as compared to where we are on our hospitalizations. The testing remains in the low range, and that's because of a reduced demand. Our hospitalizations are up 6. Our ventilators are down 3. And so you can see that the cases continue to be at a low level. That leads me to the announcement today, which is that if you go to the next one, you can see that on February 26, I came here and I said that we will end the mask mandate in Arkansas if we meet certain public health criteria. And this just reiterates what that criteria is. And the first one was below 10% on our positivity rate, but we had to have 7,500 tests during that time. We have dropped below that, and so you look at our hospitalizations, which would be fewer than 750 patients. As you can see, we're far, far below that. And so by the criteria that we set, it's an appropriate time to lift the statewide mask mandate. And so I'm announcing today that the statewide mask mandate will be lifted effective today. And I would add that this does not mean that the use of the mask will cease. This mask that I wore in here today, I will continue to have that available. That will continue to be a part of my wardrobe as I leave the house and go to work every day, because there'll be many times during the day that I will wear the mask. While I've been vaccinated, it's important to be courteous to others and to be mindful that we need to protect ourselves and others. And so common sense should govern. And in addition, we want to look at as you think about where we are with masks in our society and here in Arkansas, please respect the decisions of others in regards to masks. And that is true whether it is a private business or individuals. And I just listed some of the decision points that businesses and others will have to make. Restaurants, I've talked to a number of restaurants that will continue with requiring masks within their restaurant for the safety of their employees, for their patrons that come there, and they want to have the highest level of safety until more people get vaccinated. And some others will choose something different. They have the flexibility, but there'll be many that will continue to require a mask while they're not eating in the restaurant. Hotels, many hotels will continue to require masks. Government buildings, here as I mentioned early on, that state employees will continue to be required to wear a mask if you cannot socially distance. That's for the ability to be able to come back to work in a safe environment in respect of others. Salons and barbershops, stores, event venues, all of these very well will have a posting that mask will be required. And so while we're lifting the statewide mask mandate, it does not mean that it ends in every venue, and people will make their own decisions in that regard, both business and individuals. Schools, I'm going to have Secretary Key talk about that more, but schools can opt to continue the mask policy within their school. They actually have to make a decision by the local board, and they have to post that decision, and they will be able to have that local option to continue the wearing of masks in their school based upon the decision that the school board makes. The Department of Corrections, I was notified today that the board of the Department of Corrections voted to continue the mask policy within the Department of Corrections, that congregate setting, and they viewed that as important until later on where it can be reviewed down the road. Hospitals and healthcare providers, if you go into hospitals, you're going to be required to wear a mask. If you go into healthcare providers, many of them may require a mask to be worn. Those are decisions that are made not based upon a statewide mask mandate because it's lifted, but it'll be made based upon the decisions of the local hospital or healthcare provider and what they believe is best for their patients and for the health of their hospital or clinic. And so please be respectful and mindful that while the mask mandate is lifted, there will be many that will continue to wear it. Many businesses will continue to require it. Be respectful of that, and if you don't want to comply with that, then you have options to go somewhere else. That's what it means whenever you lift a mandate, and individuals can make responsible decisions as well as businesses. We just need to honor those decisions. And then let's go on from there to the second announcement, which is that effective today, Arkansans age 16 and above are now eligible for the COVID-19 vaccine. This opens up all the vaccine eligibility categories to every adult above 16. There's the vaccine line. You've been waiting for this opportunity. You can call it. They can direct you to a local clinic or a local pharmacy where you can get the vaccine. And so this will obviously increase the demand for the vaccines. It might take some time to get the appointment that you want, but we're opening it up because we want to make sure we maximize every opportunity to get this life-saving vaccine into the arms of Arkansans and to accelerate that to the extent that we can. President Biden urged that by April 19th, he wanted to see 90% of Americans that are eligible adults to be eligible for the vaccine. Well, obviously, we're meeting that goal today because as of today, it is full open if you're above 16 to get the vaccine. We want Arkansans to get it because this is our path out of the pandemic. It is the way to get there quicker, and we want to make sure that we give every Arkansan that opportunity. Let's go to the vaccine report, and this is a little different because I wanted to take the CDC data, and so this is Center for Disease Control data that shows the total doses that have been distributed to Arkansas at roughly 1.6 million doses. That comes through our state program, that comes through our federal partners and our federal pharmacy program, as well as through our federal institutions like the Department of Veterans Affairs that we had here last week. The total doses administered through all of these different partners is 1.1 million doses. And that gives us a percent given out according to the CDC of 69.4%. It breaks down to individuals that have received at least one dose and those that have received 2 doses. Obviously, some of those are fully immunized with 1 dose. And so we'll be reporting from time to time on the CDC numbers. Today will be posted on the Department of Health website, the specific numbers that apply with the state program, so it'll look a little bit different. Those are the numbers, though, according to the CDC, of those that are being vaccinated in Arkansas. And then let's go to just the graphs, and I wanted everybody to see where we are in terms of our pattern and trend lines. And here is a 7-day rolling average of confirmed and probable cases. You see the right trend line, the one we want. And then next you see the number of currently hospitalized. It's flattened out at below 200. We hope that that will continue to decrease. And then you'll see the number of active cases that is as low as it's been since last summer, I guess it was, or last May or June, 1,717 active cases. The 7-day rolling average of percent positivity is below 5%. That's great news. And then I believe that is all of those. And so I'll leave with this final message, and that is that with these good numbers, people have a tendency to say, we're out of the woods, there's not a problem anymore, COVID-19 is not in my community. Well, Dr. Romero reminded me today that we have increased the number of cases in terms of the variants that have been found in Arkansas. We see many surrounding states that have gone up in cases. And we see a national trend that concerns the CDC and Dr. Walensky of the CDC. And so we want to make sure we stay in the right direction by taking these steps, but continuing to be careful in how we conduct ourselves, respectful of others, wearing a mask when needed, and then secondly, making sure you get the vaccine. Get the vaccine, don't delay, get the vaccine. And with that, let me invite Secretary Johnny Key to come first, followed by, we'll let Dr. Romero back clean up today.
Thank you, Governor. In the state of Arkansas, we are having a successful school year. We have currently approximately 80% of our students that are receiving on-site instruction. And one of the reasons for our success has been the layered approach that we have taken to following the guidelines and implementing the protections against the spread of the COVID-19. The masking has been a critical component of that. With the end of the mask mandate, and Jeremy, if you could go to the next slides, please. We are allowing local districts to make the decisions on whether they want to continue having a mask mandate at the local level. They do have to take, the boards of the local school districts have to take some action either to continue, to modify, or to eliminate the mask wearing policies. Why is this important? Well, mask wearing, as you'll see in a second, may be taken into consideration when identifying close contacts and identifying persons that may need to quarantine. When reviewing local policies, the boards need to also consider all of the areas of the school. They need to consider what happens on the school bus. They need to consider what happens in cafeterias, in the hallways, in the areas of student activities. Okay, if you could, next slide, please. This is important as well because districts have to publish their plan for continued safe operation on their website as a requirement of the Federal American Rescue Plan. This should be developed in conjunction with the Ready for Learning committees. In probably every case, this is simply going to be a modification of your Ready for Learning plan that you adopted and published back in the fall. It must be posted by April 15th of this year, and there is a requirement that they have to receive public comment. This public comment will then be used to make whatever modifications they may need to make going into the summer and the fall. Now, as it relates to the next slide, as it relates to identifying close contacts, if a school keeps a mandatory mask policy and both parties are wearing masks appropriately, the infected person and the close contact person, if they are wearing masks properly, then the close contact would not be required to quarantine. If at least one of those individuals were not wearing their mask properly, then the traditional quarantine guidelines apply as issued by the health department. If a district chooses not to have a mask policy, then the traditional quarantine guidelines will apply. So again, it is left up to the local districts to make these decisions. They must take some affirmative action by their board and publish that to their patrons. We'll be glad to follow up with any questions after Dr. Romero's comments.
Thank you and good afternoon. First of all, let me address a question that the governor brought up about number of deaths. He was concerned about, as always, any death in Arkansas. We did have 15 deaths. 7 of those, he is correct, 7 of those are delayed reports. So they occurred outside of this cycle, and this is common for us to get these, but he is correct, 7. So regarding vaccines, we are pushing forward. We are using the CDC numbers, as you saw today, which give a reflection of the total pool of vaccines that are being given to us and that are being administered. And you can see that we are making headway in administering the vaccines. We will be modifying as we go forward and we get more vaccine, how we're going to be delivering these. There will be, as has been in the past, significant mass events or large events for vaccination and possibly more of these, which the governor will announce in the near future. I want to make it very clear that it's important for those individuals that are not receiving the Janssen vaccine to receive the second dose of vaccine. So a recent publication by the CDC showed that we are about 5% of our patients are at risk for not receiving the second dose, and our newer numbers, based on what Dr. Porter and Sima have told me, may be increasing. So again, you need that second dose to become fully immunized if you're receiving the Pfizer or the Moderna vaccine. You are not fully immunized and not fully protected until you have that. And lastly, the issue of masking. So it is a fact now that cases are increasing nationally, and there have been increasing numbers of hospitalizations. We are not isolated. What happens around us eventually reaches us. And just like we didn't see our first case for many weeks into the pandemic, these growing numbers of cases outside of the state will eventually get here if we are not careful. The removal of the mask mandate, as the governor has clearly stated, is not a statement that we do not need to mask. You need to continue to mask when you leave your home. You need to continue to avoid large gatherings. You need to follow the recommendations as per the CDC. Only that way will you be able to keep the numbers low as we're seeing them now. The epidemiologist, myself, and the governor are discussing the metrics that we will use to follow this forward and so that we can react as quickly as possible if the number of cases begin to increase within the state. So again, please wear your mask. I will continue to wear my mask whenever I leave the house and whenever I'm with someone else. It is important that we do so in order to keep these numbers low. So thank you very much. I'll turn it back over to the governor.
Questions?
President Biden has asked states to reinstate their mask mandates for those states who've gotten rid of them, and the CDC director says she's afraid of an imminent fourth wave. Does that not give you pause? Why aren't you taking their guidance?
because we made our decision in Arkansas based upon the criteria that we set, that this is a goal that we had. We achieved that, and so we stuck with the principle that was outlined and the lifting of the mask mandate. People in Arkansas know what needs to be done, and we expect them to do the right thing with their neighbors and with their businesses, and I think that's what Arkansas is about. In terms of the President's admonition, I was told the White House today that the President's continued serious regard for the virus is important, and that we will continue to reflect that in Arkansas. Yesterday, the legislature continued the emergency. That indicates we know it's serious, and that it sends a signal to everyone that while the mask mandate is lifted, let's still be careful and realize that the virus is still here.
In terms of cities that want to have their own mask ordinances, at one time they were allowed to adopt model ordinances. Is that something that is possible now? Or?
Yes, it is. We've lifted the statewide mask mandate. We have not restricted any municipality from taking separate actions if they deem that that's appropriate. So this is a little bit different, and that's part of lifting restrictions. When we lift restrictions on our citizens, we actually are lifting restrictions from a statewide perspective on state and local government as well.
The cities can have any type of ordinance they want requiring masks? Or?
Well, you know, sure, they can adopt an ordinance. I don't know if I'd want to say they can do anything they want to do, but there's a couple of, we actually provided through the Municipal League a model ordinance on masks some time ago during the early days of the pandemic when they were looking at it, and that was prior to us adopting a statewide policy on it. And so they can consider it. I would be doubtful that very many cities will, but that is their right under our Constitution and under the fact that we don't have a statewide mandate in place anymore does leave them that discretion.
You briefly mentioned that we've been finding more variants in the state. Can you tell us a little bit more about that? How many cases, what kinds, and have we found an origin for them? And I'll of course let Dr. Romero comment in a moment, but there's two variants that are present in Arkansas, and I'll give the common name for them, which is the UK variant and the California variant. We do not test here in Arkansas for the variant. We send that to the CDC that has the capacity to do that, and so we're based upon a sampling. I believe the number was 17 that we've identified cases of the variant in Arkansas. Dr. Romero?
So as the governor said, we have identified the UK variant here, the B117 variant. That variant has increased over the last few weeks. This is from the start of the month. We have had 7 of those isolated, with the largest number in the last week. In addition to that, we are seeing variants. There are 2 variants from California, the B1427 and B1429. These variants have increased transmissibility, not the same lethality as the UK variant. The UK variant has a higher lethality and a higher transmissibility. We are seeing 10 of those, and again, increasing in the last 2 weeks. So they are here. They are beginning to form part of the normal repertoire of viruses in the state. But we're keeping a close eye on this, and we will continue to sequence viruses and increase the number of sequenced viruses in the future.
Let me go remotely. Is Andrew DeMillo on the line?
Hey, Governor, thank you. Want to ask you a COVID issue and non-COVID issue. On the mask mandate, wanted to see what had changed your mind on allowing local governments to have their own requirements, given your comments last week. And also related to the mandate, are you leaving open the possibility of seeking reinstatement of the mask mandate if there is a surge? And if so, kind of what are the numbers you'd follow on that? Non-COVID issue, wanted to ask you about HB 1570, the legislation on gender-confirming treatments for minors. Wanted to see where you stand on that at this point, and the concerns that have been brought up by pediatricians and social workers and parents of trans youth. How much is that going to weigh in your thinking on this?
Well, Andrew, that's a lot. First, in terms of, why am I allowing local jurisdictions to make their own decision in reference to the mask? And that is because I'm avoiding executive orders. We're lifting the mask mandate, and if I wanted to restrict local governments, I would have to enter an executive order to do that. And so I think it's much more wise to try to move away from those mandates and those restrictions. Just like we lifted all the business restrictions, I'm lifting the restrictions in reference to local government as well. And so that's the rationale of it. Obviously, like I said, I don't expect very many will adopt any mask mandate. I think they like the direction we're going. In terms of whether that would ever be reinstated, anything is possible in the future, but I don't see that happening because we're getting the vaccine out. We're making progress on that every day. And the whole goal of the vaccination and the herd immunity is that we can lead a more normal life. And so that's the incentive, that's the goal. And so I don't see us going back from that. We just need to get more vaccines out. In terms of the SAFE Act, which is a bill that you mentioned, I'm continuing to listen, to study that. That's my habit. I want to know as much as I can so I can answer questions in regard to that. So I have some time before I have to make a decision whether to sign it or take other action on it. I've got a number of appointments in which I'm listening to people and meeting with them to learn more about it and hear their views. So I will be doing that in the next couple of days. Next question, is there a Little Rock Broadcast Media that wants to ask a question?
Hi, yes, this is Mercedes McKay with Channel 11. This question is more so directed to Dr. Romero, but recently the CDC director said that she feels a feeling of impending doom. Curious if Dr. Romero is feeling that same type of impending doom and nervous about that fourth wave.
Dr. Romero.
I am concerned that there is an upswing in cases nationally, both in cases and in hospitalizations. I think that we are at this point in the state low. We had set a benchmark. We've met that benchmark and we're moving forward. That doesn't mean that I'm going to turn my radar off for cases. As I said before, we are developing metrics for the governor so that we can advise regarding how serious if we're starting to see cases here. So I am always a little nervous about everything. That is the nature of who I am. But I'm going to watch the situation very closely here in the state.
Is Neil Gladner on the line?
Yes, Governor, good afternoon, and thank you. Kind of a legal question. Yesterday, when Legislative Council approved those 5 executive measures continuing the liability waiver is the one I'm asking you about. As I recall, when it was originally imposed, it was based on businesses maintaining the directives from the Department of Health. Now that those are gone, how will the liability waiver work, and what do businesses have to do to make sure they're covered? Thank you.
Thank you, Neil. And I would have to review the directive more carefully. And of course, the directive has been changed into a guideline, and the liability immunity does make reference to a presumption that there's not a causation between a coronavirus case and the actions of the business if the guidelines are followed. And so there is an incentive to follow guidelines. That's my recollection of it. We'll be happy to get you more information on that. So doesn't mean that there wouldn't be business liability immunity without following the guidelines. It's just that it would be easier for them to make the case that they should be immune and not have any liability if those guidelines are followed. Next question from anyone.
This is Jacqueline Froelich with Public Radio, KUAF in Fayetteville. Governor, hi.
Hi.
Regarding the SAFE Act, the Medical Refusal Act, the Transgender Girls and Women in Sport ban, what message do you have for trans children, teens, and young people across Arkansas who are watching what's happening in the General Assembly and seeing you sign so far several of these measures?
Well, they should know that we want them to have the counseling, we want them to have the treatment that they need. And if you look at the Medical Conscience Act, it doesn't prohibit the treatment, it just allows someone that it's not an emergency situation, or it's a procedure that they do not want to do for conscience reasons, allows them to decline service in that area. And so this is something that I don't expect would be exercised very often, and it'll be easy for transgender individuals to have the health care that they need, which is what we want. It just gives a freedom of choice and service for those that might have a conflict because of conscience or religious reasons. It's very important that it does not allow anyone to discriminate based upon a class of persons. That would be against federal law. You can't do it based upon race, or you can't do it based upon sex or gender or national origin. You cannot say we're going to refuse service on those bases. You can't do that. And whenever you have those protections in place, that should give everyone assurance that they're going to have the medical care that they need and that they're certainly entitled to. The other one is the Girls in Sports Act, and here again, that I thought was worded very carefully. It just simply says that if you're a biological male, you cannot compete against girls in sports, and that made sense to me. And so I signed that into law. I think that should not be a signal to anyone that they're going to be oppressed in life. They're going to have the care that they need, and we hope that they will have the opportunities for recreation that they need as well. But that's a reasonable restriction for competitive sports and girls. Next question.
Good afternoon, it's Brett Rains with 4029 News. I know you recently said you're hoping for 1 million additional vaccines over the next 60 days. Is this weighing in your decision to open up vaccinations to everyone 16 and older? And then second part, Dr. Jose Romero, is he on board with lifting the mandate? I know he says he's always cautious, but give us a little insight into that discussion, Governor. Thank you.
On the first part of your question, absolutely. Meeting the goal of getting Arkansans vaccinated, specifically the 1 million doses in 60 days, we have to keep the demand up. We have to make sure that there's both a supply, but that everybody is not restricted from getting the vaccine. So I was pleased today that we had well over 20,000 vaccines administered. We want to be able to keep up that pace. It's not going to be easy. We're going to have clinics. We're going to have to make sure it gets out. As President Biden set a goal to have everybody within 5 miles of their house. In a rural state, that might be a little bit challenging. Some people live 5 miles out in the country. But we're going to make sure that we get it into every community. In terms of the latter part of the conversation on masks, Dr. Romero, he's an epidemiologist. He's expressed to me concern, obviously, and that the more you can do for protecting each other, the better. But he understands the the broader picture that I have to have for the state of Arkansas. And so I asked him, well, set me a criteria as to, if we don't do it immediately, but 30 days from now, where should we be to feel more comfortable? And so that's the conversation we had was, I asked for the criteria, he provided it to me, and we agreed upon that, and we've stuck with it. He's been a good partner through this. I like people that always don't say yes. They express themselves, and then we make a decision and go on. Dr. Romero?
Nothing to ask.
Okay. Is there another, Alex, did you have another question?
Yes, my question was for Secretary Key. Should a parent disagree with the school board's decision regarding the mask mandates, could they have the option to withdraw their student, switch them to virtual, depending on their situation?
Well, it certainly depends on the situation. A lot of districts have virtual options, and I would just encourage parents to be a part of this conversation. As a matter of fact, in the Ready for Learning planning, we very much encourage parents to be engaged in that, along with teachers. And those districts that have virtual options, that could be an opportunity for that parent to say, well, for the rest of the school year, I would rather do this. That's going to vary on a district by district basis.
So the districts will decide if they will allow for that flexibility or not?
Yes.
Okay.
Yeah.
Is there a final question remotely?
Governor,
Hi, yes,
this
this
is
is
Samantha with
Christina Hogan.
KWA. I'm curious about this. I just want to follow up on something you said about the mask mandate. I know you say you don't foresee us ending that or ending it being lifted. If we surpass the 10% positivity rate, would you consider going back on that?
I'm not going to speculate as to what we might do down the road. As I said, in terms of the mask mandate is lifted, if we ever consider reinstating that, we will look at the data. I'll consult with Dr. Romero, but it would be my hope and belief that with the vaccines getting out, that we're going to be able to keep the pressure on the virus and keep it from spreading. That's the goal. If our population is not getting vaccinated and we see an increase in the virus, then sure, we're going to have to take a look at what measures we need to take. And so the future is in our hands about getting vaccinated, and that's what we want people to do. And then I heard one other question. Let's make that the final one. One other question?
Thank you. It's Asa Hutchinson with WMC Action News 5 out of Memphis. With a low demand for the vaccine, and you'll have to excuse, I'm in a car and it's pouring outside, but with low demand for the vaccine, with new strains in the state, do you think lifting the mask mandate is the best thing to do at this moment?
Yes, I do, because people understand the facts. They understand what is required to stop the spread of the virus. They understand it, but they've also, we've got vaccines that are increasing. We have an understanding of it. There's a weariness. There is a weariness from government restrictions and mandates, and so the people would like to be able to make their good choices, and they can make a choice as to whether they want to go into a business that doesn't have masks, or they can go into one that has a mask policy. So they can make decisions, and they know what's involved in that, and they know the group that they're around, whether they've been vaccinated. They may know that if it's a family group or if it's a get-together. They might bring vaccine cards, and so everybody knows that you've been vaccinated. So let's don't have a mandate there. We can use common sense. So I think that's the right direction for us, and that's what we've done. Y'all been great today. Thank you for your attention and the questions.